How do I administer emergency epilepsy seizure medication? When someone has a seizure that lasts longer than 5 minutes, or if they have multiple seizures without waking up in between, emergency medication may be needed. Knowing how to give this medication safely can make a big difference. Emergency seizure medications are usually benzodiazepines like midazolam or diazepam, which act quickly to stop ongoing seizures. These medications can be given in different ways depending on the situation and what from the medication comes in. The common routes are buccal, intranasal, rectal, or intravenous. First, it is important to recognize when to give the medication. Usually, if a seizure lasts more than 5 minutes, or if there are repeated seizures without full recovery, it's time to act. This should be outlined in a seizure management plan created with a healthcare provider. Before administering, gently turn the person onto their side if they are unconscious or have impaired awareness. This helps keep the airway clear and prevents choking. If they are alert, they can sit comfortably for the medication. Always wash your hands before handling the medication and check that the dose matches the prescription and that the medication has not expired. For buccal midazolam, place the liquid between the cheek and gum, allowing it to absorb through the mucous membranes. For intranasal midazolam or diazepam, use a nasal spray device or atomizer to deliver the medication into one or both nostrils without pressing the plunger too early. Rectal diazepam involves gently inserting the suppository into the rectum, which is often used in children or when other routes are not possible. Intravenous benzodiazepines like lorazepam or diazepam are given by healthcare professionals in hospitals or emergency settings. The dose depends on the person's weight, age, and specific medication. For example, intranasal or buccal midazolam doses are typically around 0.2 milligrams per kilogram, with a maximum dose of about 10 milligrams. If seizures continue, a second dose may be given after a set interval, but only if the emergency plan allows it. After giving the medication, closely monitor breathing and responsiveness because benzodiazepines can cause sedation and respiratory depression. If the seizure does not stop or the person does not start breathing normally, call emergency services immediately. Keep the person safe from injury during and after the seizure by clearing the area of sharp or hard objects. Only trained individuals should give emergency seizure medication. It's vital to follow a written seizure action plan that specifies when and how to give the medication. Remember, emergency medications are not meant to replace daily anti-seizure drugs, but are used to quickly stop prolonged or repeated seizures. Acting promptly can prevent the seizure from becoming status epilepticus, which is a serious medical emergency. Proper storage and easy access to the medication are also crucial for caregivers and trained personnel. In summary, giving emergency epilepsy seizure medication involves understanding the person's individual plan, selecting the correct medication and dose, administering it carefully via the prescribed route, and seeking emergency help if the seizure persists or worsens. Training and preparation are key to ensuring the medication is given safely and effectively, helping to protect the person during a seizure emergency. Always consult healthcare professionals for personalized advice and follow local medical guidelines to ensure safety.